The vaccine doesn't magnetize you. The vaccine doesn't let let people track you, injecting you with some device. And thank you for laughing, because what I'm asking you to consider is listen to me carefully. And I really understand about trusted sources of information. And I know you want to trust your sources of information, but I'm asking you to trust me. You heard my credentials. I went to one of the most competitive medical schools in this country. I worked for the CDC. I've worked for 27 years for the State Health Department, focusing on communicable disease control. And I'm not trying to blow my horn. I just want to tell you that I know what I'm talking about. And I'm asking you to trust me. I'm asking you to trust me, and I want you to ask yourselves, when perhaps you look at social media. Now remember that social media platforms are intended to be basically entertainment. Are you going to get your information from basically an entertainment platform? Well, I'm asking you to trust me instead of someone who, anybody can post anything on Facebook, on Twitter, on Instagram. So if you don't know the credentials of those people, even though you don't know me either, I'm asking you to trust that I know what I'm talking about when I tell you that there are myths being circulated on social media that you should not pay attention to because your life depends on it. So we know that masks work, we know that vaccinations work, yet too many people are not using these tools right now. But another thing to pay attention to is that there are many who are not yet taking advantage of the vaccination, but there are many in our populations right now who cannot yet be vaccinated. In particular, these are children under the age of 12 who will, some are already in school, some will very shortly be in full-time face-to-face learning, who can't be vaccinated yet because the vaccines have yet to be approved in that population. We hope that will come soon, but I'm strongly encouraging vaccination as quickly as possible, because depending on the vaccination that you choose, it can take up to 6 weeks. Excuse me, it can take up to 6 weeks for us to consider you to be fully vaccinated. If you're receiving a 2-dose schedule, and once you receive the second dose, it takes 2 weeks for your body to mount that immune response that brings you full protection. So if we're looking at 6 weeks from now, where will we be if we're waiting for that? If we're waiting now, we need to do this now so that 6 weeks from now we will be fully protected. So this is one reason why I'm encouraging this as quickly as possible. But for those children who cannot yet be vaccinated, we want them to be in another bubble of protection so that we protect the people around them. If they can't be vaccinated, we can achieve herd immunity and prevent the spread of this virus to others who cannot yet be vaccinated. So we can protect them with vaccinating ourselves, and we can protect them with the use of masks. And there's abundant evidence that shows that schools were among the safest places to be when there was high levels of community transmission in other settings, because in the community as a whole, these studies have been published by the CDC, when they were not widely adopting the use of masks, physical distancing, and hand hygiene, but in schools there was minimal transmission of the virus that causes COVID-19 in schools. They were among the safest places to be. Well, now I'm very concerned that with the relaxing of those recommendations, that the schools can potentially look just like the surrounding communities. And at this time, what our surrounding communities look like is that by CDC criteria, 44 of the 46 counties in South Carolina are defined as being at substantial or high rates of transmission. That's what our communities look like. And on August the 5th, the CDC released new guidelines for K-12 schools, and also released guidance for the general public that if you're in a community where there's high or substantial transmission, then you should be wearing a mask when you're indoors and you cannot physically distance yourself from other people.